So today we are going to be discussing Medicare 101. So really just getting the basics here, getting your feet wet, and hopefully answering a handful of the questions that you're coming in with. So I am Ben Rothering, the Medicare specialist here at WDS Health. I joined Wealth Distribution Strategies about 2 or 3 years ago here, and it's been a great partnership. It's a great opportunity for people to get a lot of their major services all under one roof. Having their finances taken care of, myself taking care of their health needs, their Medicare needs, and having an in-house tax guy. And it's really adding a full team to your retirement needs. So it's a great opportunity there. So we'll get going here, and I'll tell you a little bit about myself as we go. So that's my crew, a little bit of a dated picture by a couple years, because now my youngest is taller than my wife, and he likes to make sure that she knows that. But what I do on a daily basis is really helping people with Medicare, and helping with Medicare supplements, Medicare Advantage plans, drug coverage as well. And when people are getting done with their group coverage, they like to be able to continue their dental, vision. I also help with extended cancer protection, funeral and estate trusts, and then a whole bunch of different opportunities for life insurance, whatever your needs are. So anything we can do to help you out, we're here to do that, and make sure that you feel like you have a good retirement protection plan in place. So part A, now, as we get going here, I'm going to refer to two different groups. So one group is a group that is not yet receiving their Social Security benefits. The other group already is. So the reason why I break it down that way is because if you are someone that is getting ready to turn 65, and if you've already started receiving your Social Security benefits, Medicare, guess what? The government knows you're getting ready to turn 65. And so they are automatically going to enroll you in Medicare A and B. They're going to send you your card 3 months ahead of your birth month, and you have to decide what you're going to do with that card. And we'll go further into that momentarily. If you are not receiving Social Security and you plan on going on to Medicare, we have to do that enrollment. That's where that online account is going to be very, very helpful. Now, Part A, it should be premium free for most people. As long as you or a spouse have paid taxes, you've worked long enough, then Part A should be premium free for most people. Something else that can kind of throw a little bit of a wrench into the mix is if you are contributing to an HSA, a health savings account. So you are not allowed to contribute to a health savings account and have any part of Medicare. Okay, you're not allowed to overlap those things. So if that's something that a category that you fall into, then that's certainly something that we can take a look at and chat about, and make sure that you don't end up having to pay some of that contribution back. Okay. Now, as I mentioned, Part B is going to carry a premium along with it. And right now, the way that they determine that premium is they look at how you filed your taxes from 2 years earlier. So this year they're looking at 2023. And if you filed individually or if you filed jointly, okay? And they're going to put you in one of these brackets. And then you can see on the bottom row what your Part B premium would be. So the base premium is $185, okay? How do these Part B premiums get paid? Okay, let's go back to our two groups. If you are not receiving Social Security, but you decide you're going to go on Medicare, that's fine. You can do those things at separate times. But if you're not drawing Social Security, then the government is going to start by billing you quarterly. So you'll get a bill in the mail, and it should designate the months that bill is for, okay? If you are receiving Social Security, then what's going to happen is they are going to deduct your premium amount prior to depositing your Social Security money into your account, okay? Now, if you find yourself in one of these higher brackets, then yes, your Part B premium is going to go up. There's also going to be an additional towards a drug plan premium. And as years go on, if your income goes down, then yes, your premiums can change. They can go down. So the government, they're talking to the IRS, right? They're going to send you that letter, and they're going to tell you, here's what we expect your premium to be. And if you disagree, you have the opportunity to appeal, and they give you a list of reasons why you might think that that they're wrong, and you can certainly appeal and see if you can get your premium knocked down a little bit. So we are going to get into the what we call the alphabet soup of Medicare here. So the A, B, C, and D. So A is your inpatient hospitalization. B is your outpatient medical. Part C is Medicare Advantage. This is privatized Medicare. And then Part D is prescription drug coverage. So we're going to break each of these down individually. And as we do that, we're slowly going to fill in this healthcare pie a little bit. So we'll see where Part A is going to come in and help, where Part B is going to come in and help. But then we're going to see where there are still going to be potential gaps and what we might need to think about as far as picking up and filling some of those gaps in. So Part A is all about your inpatient hospitalization. If you are admitted to the hospital, and I stress the word admitted because there's a difference between admittance and observation into the hospital. Okay, it doesn't mean you're not covered, it's who's covering it. And is Medicare going to continue to follow you? Because there are certainly rules and regulations that we need to follow. So, this is how Part A is going to jump in and start filling in that healthcare pie. So, Part B is your outpatient regular doctoring, specialist visits, therapies, durable medical equipment, ambulance services, preventive care, those types of things. And when you start Part B, you have 12 months to do this Welcome to Medicare preventive visit. And then every year after that, Medicare is going to pick up an annual wellness visit. And part of Part B is covering a handful of different preventive services. So here's a handful of them. It's not all of them. Medicare has their list of preventive services and the frequency that they want to cover them. So this is how Part B is going to jump in and help fill in that healthcare pie. But you can see there's still a lot of gaps there, and we kind of talked about a handful of those. And we're going to show you a little bit of how we can try and help with those gaps. So Part C is all about Medicare Advantage, or what we call privatized Medicare. Okay, so first you enroll in A and B, and then if you decide to go the route of an Advantage plan, then what happens is now you've enlisted this private insurance company to really come in and take over for original Medicare. So they're going to take your A and B and they're going to kind of put it up on a shelf. You still are paying that Part B premium, but now that's just getting rerouted to this private insurance company that's now administering your plan. When it says that Advantage plans are optionally renewable every year, supplements, when you look at the guidebook that is put out by the Commissioner of Insurance, supplements are listed as guaranteed renewable for life. So what that means is a supplement, you're paying a premium on the front end, right? The Advantage plan, you could have no monthly premium. It's kind of the reverse for a supplement where you're going to pay a premium on the front end and you don't pay as much as you go, right? Because you're paying it up front. And every month that you pay that premium, your supplement is renewing. Okay. So as long as you pay your premium, then supplemental plans, they cannot cancel on you. Okay. They can't go away. There's no service area that's going to change. As long as you're paying your premium, you're good. They can't go away on you. Okay. Out of pocket costs can change over time. So one of the things with a supplement is because you are paying your premium on the front end, premiums are going to change. No company can get away from medical inflation and Medicare changing their numbers and people getting older and age inflation, all that stuff. It is going to factor in and premiums will change. There is not a company around that can get away from that. Okay. Um, and then when we talk about these additional benefits, if you go with A and B and a supplement, we need to pick up a drug plan. If you want dental and vision, we need to pick that up as well. Okay. So all things that are easily done, it's a different way of approaching. Okay. And then when we talk about prescription drug coverage, so Part D, it's only prescription drugs. We're not talking about vitamins, over the counters, anything like that, strictly prescriptions. Now, I represent a handful of different companies, whether they offer supplements, Advantage plans, or both, and then some that offer drug plans as well. And, I would love the opportunity to meet with everybody and, figure out what's going to be best for you. And I hope what you've gotten from me today is and understand about me and how I operate is I prefer to take more of an educational approach. I don't like being a pushy salesman. It makes me really uncomfortable. So my goal is to try and help you understand the process. And this is a great way to start doing it and to get this information in pieces, right? Get the basics of Medicare. Then we can follow up with some questions and then start delving into your different options with Advantage plan supplements and drug plans. And my goal is to make sure that you understand the differences and we find a path that best fits you. I don't care which direction you choose. I don't. I care that you are comfortable with your option and your choices and you understand them. That's the goal because your choices are going to affect you. They're not going to affect me. Okay. There's a whole lot of information out there. Mailboxes are probably busting at the seams. You got people calling you all the time. Um, you know, I like to kind of shoot straight and make sure that people understand what's going on and keep you up to date on things. So thank you everybody. I appreciate the nice comments as well. Please take down my information and I'd love to hear from every one of you and love the opportunity to help you out and make sure that we find a plan that best suits your needs and get you a nice retirement protection plan going forward. So I appreciate you being here with me, with us this evening, and look forward to hearing from you in the future.